Good afternoon. Welcome to our webinar. My name is Roshni Devchand, and I'm the Director of Education at the Cancer Support Community. Please note this webinar has been pre-recorded. For those joining us for the first time, I'd like to share a little bit about the Cancer Support Community. We are a global nonprofit dedicated to uplifting and strengthening people impacted by cancer. Our mission is to foster connection, compassion, and knowledge through professionally led psychosocial support, healthy living programs, social connections, and our award-winning education series, Frankly Speaking About Cancer. These services are offered at more than 200 Cancer Support Community, Gilda's Club, and healthcare partner locations, as well as online and through our toll-free helpline. When you connect with us, you are supported by licensed community navigators and resource specialists who provide patient navigation, financial counseling, CAR-T concierge services, genetic and biomarker counseling, clinical trial and pediatric support, and much more, all at no cost. For over 40 years, we have been a relentless ally, helping individuals and families manage the realities of this disease and reclaim a sense of normalcy. We are grateful for generous support from Johnson & Johnson, who made this program possible. We partnered with Young Lung Cancer Initiative and GoTo for Lung Cancer to better understand how patients can take an active role in their care by understanding biomarker testing. I am extremely grateful to have with us today a lung cancer medical expert, patient advocates, and survivors to speak about lung cancer and the importance of biomarker testing. We're joined today by Leah Phillips. Leah is a stage 4 non-small cell lung cancer patient, advocate, and co-founder and executive director of the Young Lung Cancer Initiative. Diagnosed in 2019 without known risk factors, Leah uses her experience to educate and empower others while raising awareness about lung cancer in young adults. She lives in Louisville, Kentucky with her husband and her 3 children. Leah, thank you so much for joining us today. Is there anything else you would like to share or add to your introduction?
No, thank you so much for having me. But also, I am one of the co-founders of Young Lung Cancer Initiative, another resource that's out there for patients diagnosed with lung cancer at 50 years or younger.
Thank you, Leah. Welcome, Jill. Jill Feldman is a leader in patient-centered lung cancer advocacy, transforming research and care through lived experience and strategic collaborations. In 2009, Jill was diagnosed with lung cancer at 39 years old with 4 small kids. She is co-founder and president of the EGFR Resistors, a global nonprofit dedicated to improving outcomes and quality of life for people impacted by EGFR positive lung cancer. With over 40 years of advocacy, Jill brings the collective patient perspective to national and international efforts, serving on steering committees, advisory boards, and guideline panels. She's a frequent speaker at oncology conferences and a passionate advocate for integrating the patient voice into research, trial design, and care delivery, ensuring that it reflects the realities and challenges patients and families face. 16 years later, Jill's story illustrates hope and progress in lung cancer and a relentless commitment to ensuring the patient voice shapes the future of research and care. Jill, thank you so much for being with us today. Is there anything else you would like to share or add to your intro?
Thank you for having me. The only thing, unless I heard it wrong, I have not been an advocate for 40 years, 20 years.
20 years.
20 years, yeah. So over 20 years, but yeah, I would have been really young advocate at the time, but no, thank you. Thank you for having me. This is such an important conversation and I appreciate the attention it's being given.
Thank you, Jill. And welcome, Lindsay. Lindsay Doherty has been passionate about and dedicated to oncology since childhood. She graduated from University of Vermont with a BSN in 2012 and began her career at Fox Chase Cancer Center in Philadelphia, Pennsylvania. She worked on the surgical step-down unit and ICU from 2012 to 2018, and in 2018 graduated with her doctorate in nursing from Temple University, focusing on adult health and gerontology. She began her career as a nurse practitioner in 2018 at Christiana Care Health System in Newark, Delaware, as a founding member of the Inpatient Oncology Service. In 2020, Lindsay transitioned to the University of Pennsylvania in Philadelphia, where she continues to work as a medical oncology nurse practitioner in the outpatient realm, focusing on head, neck, thyroid, and lung cancer. In 2023, Lindsay became the clinical manager for the head and neck, thyroid, lung, and neurology medical oncology teams. Lindsay, thank you so much for being here. Is there anything else you would like to share or add?
Thank you for having me. And I just, I want to echo the sentiment that I am so thrilled to be involved in this discussion. It's such an important thing to talk about. And, education and support is just a wonderful, it's a community builder, and it's a wonderful way to advocate for yourself. So thank you.
Thank you, Lindsay. And thanks to all three of you for being here. Welcome, welcome. Before we dive in, I do want to let our attendees know that while this webinar has been pre-recorded, we encourage you to submit your questions to the Q&A tool to guide upcoming education efforts around lung cancer and biomarkers. So let's dive in, talking a little bit about understanding lung cancer broadly. Lindsay, can you explain the difference between small cell lung cancer and non-small cell lung cancer?
Sure. So in lung cancer, I think first off, I think it's important to just go to the basics, which is that there are different types of lung cancer. I think, it's sometimes you hear you have lung cancer and then it feels like that's one thing, but there are so many different versions. The two main groups, as you're mentioning here, are small cell, which is less common and is the type of cancer lung cancer that is so commonly tied to smoking and the risk of smoking. It is less than 20% of lung cancers and is typically a cancer that starts in the bronchi, which really just means it helps us in terms of the diagnosis. And it can be a cancer that is quite aggressive. It responds to chemotherapy in a different fashion than other forms of lung cancer. And that type of pathology and small cell lung cancer itself has a very different realm of treatment and options that are growing and evolving in and of themselves. But it is quite specific in terms of it really tailors everything about how we treat in that realm. On the opposite side, there is the non-small cell lung cancer, which is also broken down into several categories. But it is important to note because it is much more common. It is often slower growing. It starts in different areas of the lungs often than the small cell. And the world of treatment, and especially when we're talking about biomarker testing and how important that is absolutely essential, in particular in non-small cell lung cancer. Non-small cell lung cancer can be broken down into several different pathologies within that arena, the most common being something called adenocarcinoma. And then there is another form called squamous cell, which is within the non-small cell lung cancer world, is the one that is often related or connected to smoking in general. All the other forms, and particularly the adenocarcinoma, or even patients who are diagnosed with the squamous cell and are patients that have not smoked to a great degree in their life, the world of biomarker testing is absolutely essential in regards to how we treat these patients. And so many of them have biomarkers that inform everything about the treatment that we give. And so in essence, when we're talking about lung cancer and the forms, this is why even knowing the type of lung cancer that you have is so essential to beginning. That alone begins the conversation around the way you'll be treated, the way that your disease may progress or change. And it is so important to know the differences and to talk to your healthcare provider about them.
Thank you so much for that. And clearly, in just the way you've described the different types and subtypes, that just raises the importance of knowing what type each individual has, as well as the various treatment options and paths. And it sounds, and even sort of the risk factors for each of the different types varies. And there, perceptionally, there's such a strong tie between lung cancer and smoking. Can you talk a little bit more about some of those misconceptions on the risks and who gets these different types of lung cancers, or who's more at risk?
Yeah, I think that, there's such a stigma in the, in so many forms of cancer, but in lung cancer in particular, and its connection to smoking. And as you can, kind of hear from even just the beginning of this conversation, there are forms of lung cancer where we see that, direct tie and that connection to smoking, but there are so many other factors involved. There are so many things that are important to kind of break down that stigma, to understand, that there's no, I think that the stigma around smoking and lung cancer brings this shame or this kind of fear of discussing things like biomarker testing, because you feel like you already know, or why you have this, and so many times that's not true. And so it's so important to kind of move away from that and understand, again, the type of lung cancer that you have, and the things that can drive that lung cancer, which are, many times smoking may have an influence or a factor, but it's not directly tied, and certainly isn't going to influence the course of that treatment, or where, where it comes from, if that is, and that's often what people feel. So as we talked about small cell, there is this connection to smoking, and in the non-small cell world, in the squamous cell, but there is this world of biomarker testing and the drivers for cancer that so many patients and even providers in some way don't understand, which leads to all this stigma and fear around even having a conversation about cancer, or or smoking, or the lifestyle factors that may have been a factor in the cancer diagnosis itself.
Yeah, all great points. Thank you for raising that. And again, just really underscores the importance of having that conversation early and often about biomarker testing, and how it can really impact treatment. So let's dive into that a little bit more and talk about that importance of biomarker testing. And Lindsay, again, can you simplify what biomarker testing is and why it's important for patients to ask about it?
Yeah. So in the non-small cell cancer world, and even, I mean, and truly in any cancer diagnosis, and in lung cancer, I think that I would advocate that having a conversation about biomarker testing is absolutely essential, in terms of the way that you can understand your cancer. It lends to so much in terms of the conversation around pathology, around what you're actually diagnosed with, and then what we do about it, and your quality of life, your connection to your treatment, everything. It's just absolutely essential in terms of the way you view your cancer, and what will your autonomy in it. I think so. That's number one. Biomarker testing is, in essence, what we do when we test the either tissue sample. So, you get a biopsy and you have tissue tested, or when we use a blood sample to test for circulating tumor DNA, and we test for these biomarkers that inform the way that your cancer divides, grows, and how it's really, how it is fed, or grows within your body. So it is so important, because it can directly inform what you get in terms of treatment. And also, if you are going into treatment without having this testing, and these kind of standard therapies are used, and you don't know that you have this biomarker that can inform your treatment, your response, or your cancer's response to the treatments that are given, can be, severe, can be diminished. It cannot work, or you can have, if you do end up finding that you have one of these biomarkers, having had other treatments in the past can inform your side effects and how how everything goes in terms of your treatment after that. So it's absolutely essential. Biomarker testing is an important part of all non-small cell lung cancer. Like I said, I think everybody should have that conversation and talk to your provider about being tested. It can be done in some facilities in-house. So they take either that tissue sample, something called next generation sequencing, which is kind of the gold standard testing to look for these biomarkers. And it can be done either in-house, like I said, or it can be done through a commercial company. And that can be arranged by your healthcare team. But essentially, it's the foundation of precision medicine, of targeting these tumors, the cancer, and informing how treatment goes. It should be discussed, I think, when you're diagnosed, because there is this evolution in cancer now of us being able to utilize that information right away in treatment. And that wasn't always true. And so it's incredibly important to ask about it. There is no harm ever in asking and advocating for yourself, and for kind of learning about the connection to your treatment and to your cancer through this discussion with your provider.
Absolutely. Thank you so much for that, Lindsay. And, we talked about some of the specific biomarker testing that happens with non-small cell lung cancer. And Jill, I'm curious to hear from you, how do mutations like EGFR, for instance, influence those treatment decisions? Can you talk a little bit about that?
Sure. Yes. I just, want to point one thing out, because I think a lot of times biomarker testing doesn't happen because of implicit bias, and we all have it. Every one of us has it. Really, I think, there is a blame culture in lung cancer, and you don't see it anywhere else. And words matter. It's a simple yet profound truth. And so the over 50% of people in the EGFR community have some kind of smoking history. So that, and that's what a lot of people don't realize. And so, the divisiveness, and it's, you're walking a very gentle line with patients, of course. But they have, so I guess, really, I think talking about risk factors is really, really important, because there are more. Radon's a risk factor, being exposed to chemicals. I'm a third generation on both sides of my family that was diagnosed. And I have an older brother who suffers from mental illness, but he's been rolling and smoking his own cigarettes since he was 16. And he does not have lung cancer. So I think it's really important just to make sure that people realize you can still have a biomarker regardless, and that testing is absolutely critical. And of course, that it doesn't matter, right? Who cares what the risk factor was? What matters are people, and using language that helps and is guilt-free and empathic, and our community really changing the conversation around that. And I think then we can end the stigma. But yes, there are very different, treatment depends on what change is making the cancer grow. And so specifically, EGFR was one of the oncogenes, they call it, because it drives the cancer. One that was found, one of the earliest found, and the important thing is the type of treatment that somebody receives depends on whether they have an EGFR mutation or insertion, let's just say some type of change in the EGFR gene. But what it does is it causes the protein to become overactive, like turning on a light switch. And the way you treat it isn't like your traditional chemotherapy to just go in there and kill all these cells. It's to turn that light switch off, right? To try to stop that growth. But I think it's important to note too that not all EGFR alterations are the same. And because of these differences, they may respond, differently to treatments. And so with different EGFR mutations, it also is really important to understand which mutation a person has so that the right treatment is what they receive. And it's, and it's really hard, I think. I don't think the burden should be on the patient. We need to educate patients, engage, educate, empower. And we also need to help with educating, I think, oncology professionals, especially in the community, like Leah was talking about.
Those are all great points. Thank you so much, Jill. Really appreciate you sharing and that perspective from both a patient as well as an advocacy standpoint, and the importance of understanding the stigmas as well as the importance of biomarker testing and how that impacts treatment for everybody impacted by this cancer. Leah, would love to hear a little bit from you about how biomarker testing, what your experience with biomarker testing was and how it impacted your treatment experience.
So my experience was a little bit different in being that I was diagnosed inpatient after a prolonged time of being ill. So it was a delayed diagnosis. And the first oncologist that came in to see me was an older oncologist who had always worked at the community hospital as a general oncologist. And he did not even suggest biomarker testing. He just pretty much said, you have 6 to 12 months to live. You have stage 4 lung cancer. Go home and get your affairs in order. And, we were like, how could this be? I didn't have known risk factors and I was young. So we were pretty insistent that we get someone else from that group in. So the second oncologist that came in had said, well, I can't say for sure, but because of your age and your risk factors, I think you have something going on, like in the cancer cells themselves. So we would recommend that you have biomarker testing done, which of course we had not heard of, being that we had just were not familiar with the oncology world, in lung cancer at least. And so he explained what biomarker testing was. And they tried to do a bones, like I had a bone met on my spine. They tried to get the tissue from that, but it did not give them enough tissue to do the next generation sequencing testing. So then I had to have a bronchoscopy where they go down in through your throat and then get actual tissue sample from the main primary tumor. And that came back EGFR. The my testing, biomarker testing, did take about 2 weeks to get the results back. And the oncologist that had suggested the biomarker testing was close to my age, and I think could feel our like anxiety over, well, I have stage 4 cancer. I need to get this treatment started. So he said, why don't we go ahead and start you on chemotherapy and immunotherapy until we get your biomarker testing results back. Luckily for us, we did not do that because we just had a connection to another thoracic oncologist at Vanderbilt. And she told my husband, do not let them put anything in her body until they know what her biomarker is, because it could either cause the next treatment that would be the right treatment not to work as well. It could cause, and with the immunotherapy, the type they were going to put me on, it would have caused, basically, he said, like she said, pouring gasoline on a fire, and it just would have just made the cancer just grow out of control. So, these are not things we were prepared to ask because we didn't know. But I think, and probably most people out there watching have been diagnosed or know someone diagnosed with lung cancer. But I think for any oncology treatment, when you're first hearing you have whatever cancer it is, and here's what your plan should be, another good question to ask is, by starting this treatment, how does this affect other possible treatments, just generally, which would get the oncologist thinking and also yourself thinking about, what to do, because you are in such a state of shock and emotional distress when all of this information is being thrown at you. So I did qualify. I have EGFR exon 19 deletion, so I did qualify for targeted therapy. And while there are still side effects and it's not a cakewalk, that's something that I can do at home daily instead of having to go to an infusion center. And being that I had 3 small children when I was diagnosed, this was a game changer for me. So that would be my tip, is just always ask about how this treatment could affect or impact other future treatments.
Leah, thank you so much for sharing that experience and just how you advocated for yourself and sought that second opinion and how important that was for your trajectory in terms of your treatment experience. So really, really thankful for you having shared that and really empowering our viewers to take those steps to make sure that they are getting the best treatment for themselves and getting that biomarker testing. Lindsay, I saw you nodding along with a lot of, what Jill and Leah were sharing. Do you have anything to add to what they had shared?
I think it's a thank you for sharing your stories. It's a message that's so important. I think Leah, your point about it is, without question, I think one of the scariest moments, if not the scariest moment of your life when you're diagnosed with cancer. And, I think that the urgency around starting treatment is such an important factor and defining in regards to what happens in the future. Because as you said, that provider felt the need and wanted to do something to begin treatment. And I think every patient without fail, I don't want to speak for everybody, but I've never met one that wasn't eager to begin their treatment or their path towards working through their cancer diagnosis. And so there's this urgency, this rush. And as you said, this next generation sequencing, this, as we call NGS testing of the tissue can take weeks to come back. And so often people are so wanting to start. And in fact, when you can start the more standard chemotherapy, and really the important part is immunotherapy in this realm, it often can really change how the right treatment treats your cancer, as you said, and beyond that even can influence the side effects that you have, so that when you actually start the treatment that will work for you, you can't tolerate it because you've had this other treatment in the past. And so I think that's one of the most important and most challenging parts about getting a diagnosis. It's another reason why when I spoke about having this, this circulating tumor DNA, which is basically DNA from your tumor in your blood, and a blood test that can be done to check for biomarker testing, while unless you have circulating tissue and dependent on where your cancer is and how much is actually circulating in your blood, it influences the result that you'll get. So that's the downside of it, but it comes back within 5 days and it's quick, and it's another topic of conversation. In our institution, we do both. We do this liquid biopsy, as we call it, in whatever form, that's utilized, along with this tissue sample or next generation sequencing biomarker testing that we will do as well. And that at least allows for us to have a faster diagnosis time. So I think it's another important part of the conversation here is how to get that information and that time frame around when you get that information back. But it's a very important topic of conversation. And you're absolutely right, Jill. I think it should not fall on the patient. I think having this information is so essential, because we all need to, advocating for yourself and having autonomy in a cancer diagnosis is one of the most kind of informative parts of it, because I think the journey around cancer teaches us so much about what we want in life and, advocating for that. And so that's sometimes the silver lining. But your providers, knowing that providers are people too, and that depending on where you're going, in the community, they may not have access or know all the resources that are at hand, and maybe a provider that are treating every type of cancer rather than specialized in your specific type of cancer. And so in having that conversation about where you can go to see providers kind of at the forefront, if you have access to that, or at least kind of reaching out and having community resources to have those conversations, finding advocates, finding people that have gone through, support groups, it's all so essential. And I think sometimes we put our trust just in our provider and do exactly what they say, and without kind of being informed. And while it should not fall on the patient, I think having that information is so essential for every part of the journey.
Absolutely. And you know, multiple questions for that care team have been raised. And what do I do when I'm waiting for my biomarker test results? Like, what are the resources available to me? Who, you know, who can I speak to? What are these side effects that I'm going to be dealing with once I start this treatment? And so all of these questions are so, so important. And I'm so glad that you all are raising them and giving us an opportunity to talk through them, because I do want to shift a little bit to talking about who is your care team? How do you partner with your care team to get the best care possible? So specifically, who should patients talk to about biomarker informed treatment decisions and side effects? What does that care team look like, and what are some of the questions that patients should be asking?
Would you like me to start? So
Yeah, so go
yeah,
ahead, Lindsay.
okay.
Thank you.
So I think, you know what, the simple answer is, and what I say to people all the time is that, you know, you, depending on where you know, where and how you get diagnosed, like who you're going to see, if it's a pulmonologist who's doing, you know, a test, or like a bronchoscopy or a biopsy, if you're seeing, you know, depending on what stage your cancer is, and if you're seeing a surgeon, if you're seeing a radiation oncologist, if you're seeing a medical oncology provider, either a MD, a doctor, or a nurse practitioner or a PA. If you're seeing a, you know, a clinical pharmacist who's talking about your treatment once you begin that. If you're seeing, you know, you have nurses involved in your care team, you have social work, you have, you know, there's so many forms of support. You have support group, you have so many people and advocates within the team. But the essential answer to that question is, I think that speaking about biomarker testing can begin at the beginning of diagnosis with any provider. Now, they may not know or be the ones to facilitate that, but they can direct you, you know, and give you information or direct you to the person that you need to speak to about it. There's so much to that, right? Like, what team member is setting it up? In every institution, it may be a little bit different. With ours, you know, the second that somebody is diagnosed, our nurse navigators are working behind the scenes to coordinate this testing, be it the, you know, the liquid test, the circulating tumor DNA testing that we would do via the lab draw, or just testing the tumor that we've had biopsied, and arranging for that within our own institution. So it starts there. It starts in the beginning of the diagnosis with whoever is in that room with you, I think. And we are all a team. Medical providers, we're all a team. We work together, we communicate, you know, that's how it should be. And so communicating and supporting you is our goal. And if you don't have a team that it feels like that, then, you know, perhaps advocating for getting a team that is doing that for you, and that is sharing this information, that is working together. But then, you know, beyond that, it's when you do have a, you know, a biomarker revealed, like EGFR that we've talked about, or others, there's so many, you know, then it's about who do you talk to about what that will be like, what your treatment will be like, what your side effects may be, how, you know. And I think, you know, depending on your care team, a lot of times for me, it's, you know, you have the, you know, for me and the patients that I work with, I am kind of, you know, the person that guides their symptom management, where they can come to for really anything. And there's nurses on our team, on my team too, and then of course the attending provider that I work with, but and the pharmacists, which are so essential. And we all provide a different perspective, right? A different kind of art to what we do. And the most important part of all of it is the patient, right? And how, and the questions that they have. And so my answer would be, speak to anybody on your care team. The goal is to help guide you through this, to kind of optimize the way you tolerate treatment, the answers to your questions. Because when you do that, when you report the way that you feel, when you know, tell us and share your story, then we can optimize the way that you tolerate treatment, the length of time that you are on treatment, the way that your quality of life, right? And you know, your family as well, and the questions that you have. So I think, you know, advocating or speaking, I think so often, again, it comes back to fear when we don't communicate, right? There's so much fear in cancer, be it around diagnosis or around the side effects, and when you report them, if your providers are going to take you off of treatment or do things like that. You know, there's so much fear. And at the end of the day, I think when we voice that fear, as patients, as providers, we can share in it and we can get through it together. So I think that would be my message, my main message.
Thank you, Lindsay. And again, elevating that importance of the communication, having that open communication with the care team, with every person that is part of that team. And truly, it is a team and that support system for a patient as well as the caregivers. You talked about, different side effects that one may face and proactively planning for some of those side effects. Jill and Lee, I would love to hear a little bit more from you about, how can patients and caregivers take a more proactive role in talking to their care team about managing those side effects. For example, we know with EGFR targeted therapies, there are particularly sometimes more dermatologic or GI symptoms. So are there proactive things that you did or that you were able to have conversations with your care team about?
I'll start, I guess. Yeah, I think first of all, Lindsay, I think, everybody's always looking for the best doctors, but you are spot on. At the end of the day, your nurses are the ones that advocate for you, schedule your appointments, are there for your, so you really are the glue, and it is very, very appreciated. I think you talked about the fair, and I want to touch on that for a second, because even as somebody who knows better, the last treatment I went on, I suffered through avoidable side effects for 8 weeks because there was no data to show that the lower dose actually was just as effective. And my oncologist was not happy. My team was not happy. And it was not a smart thing to do. But as a patient, some of the times you are very afraid. You don't want to be taken off. Nobody talks about dose reductions being okay up front. And we should be talking about that, especially now that we have data on a lot of treatments that there's reason to believe that efficacy is the same with less side effects. I think that's really, really important. And the other thing is, you want to, I don't know. So the joke in my house is like, I shower, put on makeup before my appointments. I want to look like I'm worth saving. And I want my doctors and my team to be proud. So there is that push and pull, kind of with patients who want their side effects acknowledged, obviously. Sometimes they're dismissed, but hopefully not. But also wanting to be that, your team to be proud of you. And it's interesting when I see it from the outside, but when I do it myself, I'm like, oh my gosh, I'm just as bad. So so dose reduction has definitely been a thing in my world, and kind of a low threshold for any higher ones or treatment changes. And it's really helped. And I've lived with lung cancer for 16 years. So I think, people should not be afraid of that. The other thing is, talking, first of all, people with advanced stage lung cancer, it doesn't have to all be on their nurse. There is data that shows people, not only does it improve quality of life, but outcomes if people have an upfront consult with palliative care, which, by the way, palliative care helps you live. Hospice care is end of life. So I just want to make that distinction, but people don't know about palliative care. So I think that's something to ask for. I am on EGFR meds. I hate magic mouthwash. So I had a friend who was a pharmacist and had lidocaine lollipops made. Or, there are so many other tricks. I'm not going to take the time, but I think if somebody has a biomarker, they're on a targeted therapy, finding these groups, because EGFR resistors is just one of many. In those groups, you will find kind of those off-one ways that people, are able to better manage their side effects. but 100% it is, I think, if I encourage anyone, anything, it's to be proactive. If you know there was a storm, would you leave your house without an umbrella? I mean, think of the difference. You leave your house without an umbrella, you're drenched. If you bring the umbrella, you still may get wet, but hopefully it's not disruptive with treatment or life. And so I think it's really, really important to have those open conversations and to seek others who have been on the treatment, who, there are these little tricks that work for people that, our care team doesn't either know, or they're kind of different. So it's hard to recommend.
Thank you so much, Jill. And Leah, I would love to hear a little bit from you about, what your proactive treatment management looked like in side effect management, and who on your care team that you had those conversations with.
Yes, I'd like to echo kind of what Jill said about palliative care. That has been the biggest gift to me. Which when someone suggested it, the oncologist suggested it, I thought immediately, oh, that means I'm dying, and that's not the case. I think that needs to be something that's reiterated by the care team, that palliative does not mean end of life. Like, they are helping you live. So I think palliative care is a great way to do that. Even the nurses in the palliative care department, because they have more time to dedicate to the patients than like the oncologist themselves, is a great way to do it. You also like to consider like talking to other patients and learning, okay, so Jill had the GI symptom of diarrhea. What did Jill do? That is very helpful. I will say that some of these, you read your medication, it lists every possible, side effect you could have, but there are usually 3 or 4. They're kind of the top tier. But I think it's good to also be aware of what could be a little bit further down the line in terms of what are not as common. Because when I was first diagnosed, it was right before COVID, and I got terrible mouth sores, which what I'm on, that is not like the top thing that you have to deal with. So I was very shocked. And then when I went to see my oncologist, I had mouth sores coming out of my mouth, and she was like, "Oh, you should not have been dealing with that." And I said, "I didn't even know what to do about it or who to talk to." And that is something just to be aware of, that sometimes those little things will happen. But all in all, I think being proactive is good. If like skin is an issue, like sun sensitivity. I was diagnosed in January or December, so I didn't really have to deal with the sun until the summer. But I just, out of the gate, I was just religious about the 50 SPF and making sure there was an umbrella until I saw how my skin dealt with the sun. Knowing that if your dry skin is part of it, and then the winter months it's going to be worse, having those things on hand. And also talking to other people. When I had those really bad mouth sores, I actually talked to a friend of mine who was an oral surgeon. He did the same thing. He got the lidocaine lollipops and was like, "Here, these will be," but no one has ever recommended that at an oncology center. So like maybe just people who specialize in whatever, like a dermatologist or a dentist or that kind of thing, that are more dealing with that like part of your body. Sometimes that is another good tool. But I also encourage people to let hopefully you have a caregiver going with you, especially to these initial appointments, or someone, just a friend, because sometimes you are afraid to say this is happening, because you don't want to have them to say, "Oh, we need to take a break," or "We're going to reduce your dose." And for that friend, because usually the doctors or the team will say to the friend, "Well, how do you think they're doing?" And that friend can say, "Well, yeah, here's the real truth," if that's what it is. But I think they kind of hold you. My husband always would hold me accountable, and they would say, "Oh, how are you feeling?" And I'm like, and he's like, "Leah," and then I'd be like, "Okay, well," So I think that's a kind of a good tip too.
These are all such great points and insights, and I'm so glad that you all raised the point about palliative care. Cancer Support Community has great resources on really that palliative care is to support as healthy an experience as possible going through this cancer experience, and beyond that, the support system that you all talked about the various forms of support. Cancer Support Community has local locations, over 200 locations across the U.S. where you can go and meet support groups in person or virtually. There's programming for various, cooking demonstrations if you're experiencing mouth sores, things like that. And then we also have a helpline that is staffed by licensed professionals who are able to help connect individuals to resources that are going to help through this experience and through understanding who to talk to, what are the questions to ask, advocating for oneself. So just wanted to point out some additional resources that, and you all are bringing up such great points and resources that I just wanted to make sure that our viewers knew about this additional resources from Cancer Support Community as well. All of you have mentioned just sort of the importance of taking an empowered role in having these conversations with the care team, in getting the right support. I wanted to get a sense from Jill and Leah both again on how did you connect with others who had similar experiences with biomarker testing and that targeted therapy? And were there other resources that were helpful for you in your experience?
I think, okay. I'll go ahead and go first this time, but one of the biggest things is I think now social media, people oftentimes will tend to turn to social media before they even Google, because we hear stay off of Google. So then our brains think, oh, I'll just go to Instagram instead. So I think looking through, so like just searching your diagnosis in social media, you may find those patient groups or people going through it. I will say that having a person you can connect with that's local to where you are, not your next door neighbor, but you can actually physically get together with, is a huge support. Having just that person that can walk this with you. I always say that it's really nice to have someone that's just a little bit further ahead of you in the situation, so that you can look to them, and then you can also be that person to the person behind you, because you remember what it's like to be back there and you want to be what's up there. So it kind of creates a good dynamic if you have a little bit of both of those things. I know that some of the patient groups, a lot of times we hear they're so depressing, and some of them can get that way, and you just need to take a break. If mentally it's not what's helpful for you at that moment, step out. Don't get them the alerts or whatnot. Sometimes you just go in and ask a question or look for the answer of something you're needing to know. And then other times you're there daily, and that's okay. But, finding them that way, you can ask your care providers if they know of groups. And, really, because of the way social media is and the internet, you can pretty easily find, someone, and that person may know of another group, and that person knows of another group. And eventually you find kind of your best group to be part of.
Thank you, Leah. Jill, did you have
Yeah, and I think Leah's spot on with that. Personally, though, when I was diagnosed, I didn't know anybody else in their 30s, and I didn't know anyone else with EGFR because it was in 2009. And, and so understanding that feeling was part of, the creation of the EGFR resistors, because there are so many nuances to each treatment that, you don't necessarily, you can't relate to if you're not on that same treatment. And so that was actually really hard. But in general, I mean, even I got involved in advocacy before I was diagnosed, even because of my family history. And I mean, literally no amount of therapy could have ever helped me work through my losses. And then my diagnosis, like being involved in a community. I mean, at its heart, everyone's brought together by a common cause, no matter how diverse you are. And it's, cancer does foster this instant intimacy. There's nothing like connecting with others in the trenches who get it in a way that no one else can, who has not lived it. And when I say that, I mean, even your immediate family, they are your closest, your people, your ride or die, whatever you want to call your spouse or your sister or your child or parents, but they can't get it if they haven't lived it. And I think one of the things that I've really learned, I think too, is, there's things that like Leah and I could say to each other maybe that, my husband doesn't like when I joke around and say, with your next wife, you can do that. I laugh. He doesn't think that's funny, right? But, and I don't know, I feel like we want to protect our loved ones. Loved ones are protective of the patient. So I want to emphasize it's not just the patient, like the loved ones need that support, need that community, need to understand that there are people who are living the same experience and have that person that they can talk to as well. Again, our care teams are amazing, but when you really want to know what people experience, are you going to ask, the people who see it or hear it, or the people who actually experience it? And so it may take a people a while. I think there's been a couple groups like the Pickles group for children or Young Lung, like those weren't around when I was diagnosed, and my, when I became an advocate, it was, you had to keep people alive. So there was no, but they are badly needed because there are completely different issues that you are dealing with. And so I think it doesn't mean you only have to belong to Young Lung. You can belong to more than one community, and the lung cancer community is this large caring community. So belonging to many is ultimately, we're all this big tapestry of stories, and our strength is that community. So it's really, I think it can be life-saving at times, but it's definitely life-changing.
Thank you so much for that, both of you. And you raised such an important point that it can be a really isolating experience, and to find the communities that lift you up and provide that support and that sense of belonging and sense of understanding is so important for the experience. Thank you so much for sharing. And I do want to turn to just sort of a final question before we get into a little bit of a Q&A. And that is, advice for a newly diagnosed lung cancer patient. So Lindsay, I'll start with you. If you were sitting with a newly diagnosed patient right now who is either unsure or not aware of biomarker testing, what are some of the most important things you would want to tell them?
I think that the message is, that one, it is again back to that kind of initial discussion that we had around the fear that so many people experience, and how sometimes that can hinder, these discussions. You just move forward, but to take a breath. My advice would be to take a breath, to communicate about biomarker testing, what it means and how it can inform treatment, because it is something that is often, and is so essential to guiding a treatment plan, to providing quality of life, to the to your life continuing outside of cancer. I mean, that is one of the biggest messages that I would say about biomarker testing, and then targeted therapy because of that. You are not your cancer diagnosis. You are you. And so in order to protect that, in order to, promote your treatment, yes, but your quality of life and you as a person within your world, it is absolutely one of the most important things that you must discuss with your care team, that you must that directs the rest of your journey, and for so many people. And even if you don't have a biomarker that is identified that changes your course of treatment, advocate, as we've said in this discussion, having that communication around just what options are, around what it means, and then through that, all the communities that are involved that can lift you up, all of the the type of cancer that you have, like it is a driver to all of those things. The discussion about palliative care and how that promotes your quality of life and your life that you are living and not the end of it. You know, I mean, all of these things come from just by asking questions and by having the communication and the open line of discussion. And so that would be my message to communicate, to ask the questions, to, to just have that direct communication despite the fear. When fear kind of pushes you down and makes you want to just kind of drive forward without your eyes open, because you just want to kind of move forward without hearing anything else. I think that's often so much of how it feels. It's like it's so overwhelming just to hear that you have cancer, but to hear everything else can feel really terrifying, when in fact it can actually open your life up, so that you can live, through cancer. And I think that would be the message that I would want to share with people.
Thank you so much, Lindsay. Leah, I'd love to hear from you about, if you were sitting with a newly diagnosed patient, what are some of the key things that you would want to share?
I do this often, and I think, one thing is this is a very gloom and doom diagnosis when you statistically read about it or from previous knowledge about lung cancer. And I always try to remind people that you only have my second opinion oncologist, who's no longer practicing, gave me this advice of you only have to live one more day. Just each day focus on the next day until the next best treatment comes along. Try to look at this as more of like a chronic disease where you're going to have to maybe change the course of treatment, add different things, take things away. But that it's just your job as a patient is just to get to the next day and prioritize kind of just trying to live your best life each of those days. And that there's hope here, because like Jill was saying, when she was diagnosed, there wasn't things like Young Lung in the Pickles group. But even when I was diagnosed, I couldn't find a lung cancer support group that had anyone that looked like me. And I don't even mean skin color. I just mean my age and parenting and all the things. And now that's available. So there's a lot of hope with treatments and groups that are supporting patients and advocating. And then I guess my other thing I always go back to is, and this is kind of like what Lindsay was saying, you want to have a good rapport with your care team. And sometimes no matter what you're doing, it's just not working for whatever reason. Maybe the doctor is not receptive, maybe he or she is too busy, maybe it's just a personality thing. And I always say, don't be afraid to break up with your doctor. If you need someone else that's a better fit so that you can live a better life and be happier and more well treated, whatever it may be, that's okay. You don't always go to the same mechanic for your car. Some specialize in things differently, and some you just don't care for. So, obviously just speak your mind, try to be assertive when there's something that you need. And then if that relationship is not working, then it's okay to find somebody else that is. And those groups are a good place to start. We have people all the time in our group saying, okay, well, I live in, Cincinnati. Who has a recommendation of where I can go? And you can find people that way too. And then, the other thing is, EGFR resistors was kind of the first group I found that was an online community. But then quickly I realized a lot of people that were in the EGFR resistors were in my targeted therapy group as well. There was a group for just that targeted therapy. And that's another place that I got a lot of good information on how to handle side effects and whatnot, because not every EGFR patient is on the same treatment. So that's just another thing to remember is, search out that information and find what fits best for you.
That's great. That's all really helpful guidance. Thank you so much, Leah. Jill?
Yeah, that is great. And Leah, just to emphasize what you were saying, like you are the CEO of your health. Like when you think about it like that, like because CEOs get diagnosed and they just crumble, right? So if you can think about approaching it that way with checks and balances, it helps to be a little more direct. But there's a couple of things. I mean, I do always acknowledge, listen, you are drop kicked in this foreign country. You don't know where you are. You don't speak the language. You don't know the culture. The terrain is unfamiliar. yet you're trying to figure out how to survive without a map, navigating this fragmented healthcare system with a mountain lion chasing you as you're confronted with making these decisions. And again, anxiety and distress cloud your ability to think clearly. So I do, try to really emphasize that, this is a process. There are times you have to start treatment right away, but as a rule, you don't always. And, I kind of use the analogy. I said, would you treat an infection without knowing what type of infection it is? Like, you don't do that, because then you're just using some random antibiotic that not only might not work, but could cause, a slew of other problems. And that's why you get your throat swab for, strep throat. That's why when there's skin infections, they do biopsies. And so trying to really put it into everyday life is kind of the way I talk about the biomarker testing aspect of it. But, I think, communication is the cornerstone of everything, right? And so I think that is important. But, it's not something that professionals learn in school, or their degree doesn't depend on it. So it is really important. If you can't have that communication, another thing is you talk to your palliative care specialist, and because these conversations when you're first diagnosed are complex and complicated, and there's not, and so it's hard to even give all the information at once. So, I do look at one day at a time. I got this information. This is what I know now. But, my kids always say to me, what does someone do if they don't know you? And, you think about that, Leah, right? And it like is a dagger to your heart, because it's true. If somebody knows somebody who can help them, then they have that direct, right away they have that access, and you see how things move differently. So, like one of my things is, how do we make it seamless like that for everybody who is diagnosed? How can we lessen that anxiety? And, in the beginning, you're waiting for biomarker testing. Every time I have biomarker testing, I'm like, I just want to know. And, I often wonder, why can't they do it like they track UPS or FedEx, right? We get a little notice, your tissue has been shipped, or your tissue has been this. We are analyzing your tissue. We are still analyzing your tissue. Then we're done analyzing. We sent to your doctor, then at least you have control, like, where it is in the process. And the truth is, you won't contact your, care team unnecessarily. But when you see that it's there, you could also give them a heads up, earlier than maybe they normally would see it. So it's, I wish there was a real way to not have to go through that deep, dark tunnel. But I think, like Leah said, you don't have to go through it alone. And as much as you need, there's a community, here to help.
Thank you so much for that, Jill. That was such valuable insight and experience to share with our viewers. And you all have shared such wonderful experiences and insights and guidance for the viewers on the webinar today. But we are coming up on time. We have time for a couple of questions. But before we dive in, I just want to remind our viewers that this is a pre-recorded webinar, and we collected some commonly asked patient questions around lung cancer and biomarker testing. But we still encourage those joining us today to submit additional questions to the Q&A tool to inform upcoming education efforts. So I think we have time for maybe one or two questions before we wrap up. So this first question is for you, Lindsay. What is the difference between biomarker testing and genetic testing?
Very good question. So I think, in biomarker testing, it's very important, and I think a discussion that is important to kind of lean into is when you talk about, there's so much discussion around biomarkers and there's so many words that are used in that realm, right? We hear a lot about mutations, we hear a lot about, and in the world at large, there's a lot of different cancers with a lot of different meanings, right? When we're talking about biomarker testing, we are talking about testing those, cancer cells and kind of trying to determine what feeds them, how they metastasize, how they grow, and if there's something that we can use to kind of, I always think of it as like the dam of that's broken, and that's how cancer is going to kind of grow and spread throughout the body, and how we shut off that dam. And that's kind of the basis of what we're looking for. And we do that in a lot of different ways, like I said, like we've talked about so much in this program here. I think a lot of people worry about what it means for their family, and what we and the way that we kind of speak about that is sometimes confusing, and there's a difference between going and get genetic testing and looking at what your germline of your genome and your genes look like, and how that might be passed on to your children or to throughout families. And so I think it's very important to have that conversation again with your healthcare providers. A lot of at my institution, we, like I said, do this next generation sequencing testing, these biomarker testing. There's a lot of discussions around, and a lot of words, like I said, around mutations. But we can see within our panels if there are germline mutations that are seen where we need to refer to somebody completely different, a genetic specialist who can track that through your family, and would, that is an entirely different discussion and team that may be involved, that may be coming into your life if you do have something that is kind of driving a genetic connection to your cancer, or hereditary connection to your cancer. And so there's very big distinctions. I think there's even more kind of confusion when we start talking about RNA testing, which is a whole other, I think it gets very, very confusing and in the weeds for patients. But essentially, there are these two distinctions, and your healthcare provider should be able to identify what would be, what kind of germline, what test, what mutation would be found to say, this may be something that you need to talk to a genetic counselor about, because it can impact your family and your children, and it may mean that this specific test or finding may mean that we need to do different surveillance, do other tests to find different connections and ways to support that patient or that person. And so they're very separate kind of realms of discussion, and again require even just knowing the difference so that you can have the conversations with your provider and advocate for seeing genetic counselors if you need to, but also knowing that if you have these biomarkers that come up, it doesn't mean that you need to go and be tested or see a genetic specialist, or that your children are going to be affected, and kind of understanding that difference is really very important and very, very common, a very common question.
That's so helpful, Lindsay. Thank you so much for making that distinction and sort of clearly outlining that there's two different paths between biomarker testing and genetic testing. That is all the time we have for today. Thank you all so much for your time. For our viewers, we have placed an on-screen poll so that we can hear about your experience during this webinar today. If you could please take a few moments to submit your answers before you log off from this webinar, we'd greatly appreciate it. Thank you so much to our speakers, Lindsay, Jill, Leah, for joining us today on this webinar. You all have provided a tremendous amount of insight and experience, and I know that the viewers will find it so helpful. Thank you to our sponsor, Johnson & Johnson, for their generous support of this event, and to our program partners, Young Lung Cancer Initiative and Go To for Lung, for their collaboration and support. This event has been recorded and will be made available on Cancer Support Community's webpage that's posted in the chat. Thank you all again for your attention, and we look forward to seeing you at our next webinar.